Hello guys, I'm Ekaterina Kondrateva. I'm here representing ARI and Skaltech with a study titled Do we really need all these pre-processing steps for brain MRI? The motivation behind the study is pretty straightforward. We saw a lot of new architectures recently, neural net architectures recently, yet it doesn't seem a new evolving pre-processing in brain MRI, and one of the most known Kaggle competitions used the very old, so to say, pre-processing. We find out that there is no standard pre-processing for brain MRI, and each and every lab will use their own recipe of how to treat the data before feeding the neural network. We were just curious, well, are they essential for accurate segmentation or not? So to treat brain MRI, you should know that it is for modalities for brain tumor segmentation, and for most of the studies and examination, you will have the multimodal input, but it will not be the same dimensionality for each out of this multimodal, for each image out of the multimodal input. So first you should register these modality within one subject and align them to the label, to the segmentation mask. After that, you may want to standardize images within Dataset to resample to the equal spacing, or resample to the equal image size, or to the template. Then you may want to enhance the image and skull strip the image to get rid of the excessive information. We isolated all of these steps and performed the ablation study to see how each of these steps will be reflected in the segmentation quality of 3D NNUNet. We fixed the number of epochs in cross-validation, and what do we get in the very end? So for 3 classes, which is whole tumor, enhancing tumor, and tumor core, in terms of dyes and precision, we did not observe any preprocessing step to be increasing quality for all 3 classes. So green is for statistically significant increase, red for decrease, and most of the steps in pipeline, they actually increasing in one class and decreasing in another, so controversial. What we also can see in here, that skull stripping helps or does not harm, and it will take lots of time to proceed. So our conclusions were that you should resample the fastest way images to standardize them, and standardizing is needed, but how you will do this, sample to equal size or equal voxel size or to the atlas template, it doesn't really matter. Image enhancing steps are redundant, and skull stripping actually helps, but it will take lots of time to proceed. It may be changed to the longer training and data augmentations. That's it. Thank you so much.